There it is.
Okay. My name is Rob Wilkerson. I came to Dr. Steve about 2 years ago. I had a lot of joint pain in my shoulders, in my neck, in my knees, and in my ankles, and in my feet. I have, to give you a little history, I had prostate cancer, and I had been through radiation and brachytherapy. And about 12 to 14 months after all the treatment, everything was going well. I felt naturally fatigued from the radiation and the brachytherapy, but I was starting to get joint pain, and they were telling me, naturally, the oncologist said, oh, it's nothing to do with the radiation, and my urologist that I go to, they couldn't see that that was happening to me, but I was getting a lot of, still, I had never had joint pain all my life, been very healthy. In fact, I'm going to be 70 years old in December. 25th is my birthday, and I'm not on any medication. So that shows you I've led a pretty healthy life. But I got to the point to where I couldn't even bend down. My knees were hurting me to where I couldn't even do half of a squat. And my shoulders were in a lot of pain when I would try to move them and do certain just basic functions, getting dressed, trying to reach up and grab something from the shelf. And I had a friend of mine that even did Reiki on me, and he was doing it, and I got so much pain in my shoulders I had to tell him to stop. And so that's when he recommended, he says, you know what, you need to go see my chiropractor. And I have never had chiropractic work my whole life. I really didn't believe in them, if you really want to know the truth. And so my first introduction was to Dr. Steve. He took an x-ray of me. He thought, before he even looked at me, he thought my neck was in pretty bad shape, because I was telling him where my pain was in my neck and in my shoulders, and even in my hands. I had some pain in my hands where I had carpal tunnel surgery, and my other hand was bothering me, but luckily I didn't have that. But my biggest problem was I didn't feel good, and all my joints, like I say, my major joints were bothering me. And I'd never had this my whole life. I've been healthy. So I started going to Dr. Steve. And he told me, he said, you know, this didn't happen overnight, and it's going to take me a while to work on you. He says, it's like peeling an onion. You're going to have to take each layer at a time, and you're going to start to feel better, but it's not going to happen overnight. You're going to have to continue seeing me. So I agreed to it, and I started off, I was going twice a week, which I thought was a lot. But as he started to adjust me and do the therapy that he was recommending and doing exercises that he gave me to do, I started feeling better. But again, it didn't happen overnight. But each time I progressively got better. It took me close to a year going twice a week. And I was also doing some acupuncture at the same time, which I think also helped. But I think the majority, or the biggest healing factor to me, was Dr. Steve. I was also into I take a lot of supplements, and he was asking me, what are you taking? I even brought some of them in, and he did some little tests on me to see if he thought that was appropriate for me to take them. And he said, the protocol that you're doing evidently is working for you. You're taking the right minerals and vitamins and the different supplements that I do take. So I continued on. And we got into the point to where I was coming once a week, feeling better, being able to bend and squat and do things that I hadn't been able to do. He also recommended that I do exercises in the pool, which we have a pool. Instead of running, he didn't recommend that I run or do anything like that. So I walked, but I started to swim. Started feeling better, progressively better all the time. And also, he was not just the chiropractic part, but he says, okay, how's your diet? What are you eating? So also he helped me with diet, make sure that I was eating properly, which I was doing a pretty good job of to begin with, but little things that he gave me to kind of fine-tune me. And again, I started feeling better. Now here we are 2 years later, and he's adjusting me at what we call maintenance now. I can come into him and we do our little fine-tuning, and he's amazed that at my age, again, not that I'm that old a guy, but he's saying that I've coming in every 2 weeks, maybe sometimes every 3 weeks. He hasn't even, I've held my adjustments for that long. So again, I'm feeling, I can do things that I used to do before I had this joint pain, before I had my my cancer, my prostate cancer problem, when I had the radiation. But again, that's just me. I think a lot of it to do was the radiation and the treatment that they had to do for the cancer. But I feel 100% better than when I started 2 years ago. I see my urologist and my oncologist every 6 months, and my last appointments with both of them was in July. And my oncologist told me that we only need to see you once a year now. My PSA was down to a 0.2, and he says, whatever you're doing, he says, keep it up. I had mentioned to him before that I was taking supplements, but that I also was going to a chiropractor. And I mentioned to him that I was having the joint pain, and he says, well, it's, you know, naturally they're going to tell you it's not from the radiation, but whatever. He says, well, if it's working, keep it up. The same thing with the urologist. When he did a DRE, he says, your prostate is staying small. He says, I can't even, as in other words, it's not enlarged like it was. And he says, I can't even tell that you've had brachytherapy and you've had a problem. He says, so keep up with whatever you're doing. And I also mentioned to him that I was taking the supplements along with going to Dr. Steve and having the chiropractic help. Now that I've seen the benefits of chiropractic care, I've got my wife and my son coming to Dr. Steve.